or on YouTube, channel 𝗛𝗲𝗹𝘁𝗵 8:10 a.m. Radio Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with 𝗏𝗏𝗃 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗃. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗃 on 𝗛𝗲𝗹𝗁 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗃, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search 𝗛𝗲𝗹𝗁 Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗃 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗃. I'm your host, Nicole Jacinto. Now, this week on Healthline, yes, today, right now, I have 3 doctors with me, okay? We have Dr. Ana Patricia G. Aninang Protasio, Dr. Jacqueline Ana K. Joaquino-Sia, and Dr. Hill Anthony A. Mamurek. Okay, so they're doctors and they are our resource persons for today. And I understand a little later on in the show as we talk about our topic for today, which is facial reanimation surgery, they're going to talk about an experience they actually had recently. That was December 3, where they actually did this surgery. And so when I dish out the questions today, which I'd like to thank Micaela, by the way, for helping me put them together and helping organize this, I say the more the merrier on the show. And today I'm gonna be able to interview a team that has recently done this, and it's very interesting. So facial reanimation, not facial reconstruction, but I'm sure these guys know how to do it because they are facial reconstructive and aesthetic surgeons, all 3 of them. We're talking about facial reanimation and a certain technique or certain techniques, and you know why this is necessary, what it's usually applied to. So now that you're tuned in, don't go anywhere because we're going to start the show. Okay, so anyway, how are all 3 of you doing today? And thank you for being on the show. This is a really exciting show for me.
Thank you for inviting us. Mona, thank you.
It's our pleasure. It's our pleasure to have you on the show today. And folks, if you'd like to get your questions answered during the show, send them in now. But we have a bunch of questions here already, and I'm sure the doctors will explain things very thoroughly to us. Okay, so for the first question that we have here, can you briefly explain what facial reanimation surgery is and what conditions or maybe illnesses it might address?
Mm-hmm. So basically, facial reanimation surgery is also known as a 𝗏𝗶𝗃 procedure. So this was named after the French surgeon who invented this procedure during the 70s and the 80s. Technically for us, it's known as temporalis lengthening myoplasty. So basically, 2 goals of the surgery is, number 1 is to restore or somehow achieve facial symmetry. And number 2 is, of course, restore the patient's smile. So meaning this procedure is applicable for patients who have facial nerve injuries. So it could be caused by diseases or viral diseases caused by a possible previous surgery or from previous tumor, which could have affected the nerve. So basically, the principle of this surgery is we use the temporalis muscle, which is the muscle here.
Okay.
In the temple.
Is that in the temple? So that's like on the sides of our heads. I'm just making the action for those who can see, and also for those of our listeners who listen on radio and cannot see. So it's the temples. Yung sinasabi yung utak mo, or you know that kind of when we say that. Okay, you use the muscles there.
The muscle here is the temporalis muscle. It's one of the muscles for mastication or chewing.
Hmm.
So it's a voluntary muscle. And so we basically borrow the action of that muscle, and then we attach it to the affected portion. So for instance, if it's the left side, so
Mhm.
we attach we release it from its attachments, and
Okay.
then anchor it to the muscles along the nasolabial fold.
Okay.
So as the voluntary muscle, the temporalis muscle moves, so this is synkinesis, so it moves with the affected or weakened facial muscle. So that's basically how to simplify things for this procedure.
Yes. Okay, thank you, doctor. I have a couple of questions based off what you said. So I mean, facial reanimation surgery is used for things like, for example, if somebody, got Bell's palsy, which is thought to have come from is thought to come from a virus of sorts, or you did mention previous surgery, like if somebody had surgery done for whatever reason. Yes, I have seen, like, okay, I'm not gonna name them, but I have a few relatives that, at certain reunions I didn't get to greet them because I didn't recognize them anymore because they had a lot of like facial work done, and then I'm like, oh, and then they can't seem to move their face. Or perhaps if somebody overdid the Botox or something like that. Or as you said, from any injury, like if somebody got into an accident and their face got slammed and the nerves in the face got damaged. Or and you also mentioned some tumors, like would those tumors be in the face or the brain area or anything like that? Basically anything that affects facial nerves. Yes, okay. All right. Okay, so thank you for explaining that very thoroughly, because it's not just like, it's not just in terms of people wanting to, let's say, beautify themselves or, add a smile. You are actually restoring a function that is very important for people's health, self-esteem, and, and other things. Okay. Now, excuse me, just a second. Children, let us put ourselves in the presence of the show. No secret for them, folks. Just a second. Wow, what happens when you're live? Okay, just a minute. There, I used my outside voice. Okay, so back to the show. Usually they're very well behaved, but I guess they want to know more about facial reanimation. Okay, now, okay, I know another one of you is going to answer this question. You were talking about the 𝗲𝗶𝗶𝗵 technology, which was named after a French surgeon who did it, who invented it in the 70s and 80s. Now, can you tell me what's unique about this procedure, aside from the description of it having been, using the temporalis muscle on the face, I mean, on the side of the head? And why is it like the most, is it the surgery that you opt for the most? Has it come into more popular use recently?
Okay. Hi, good afternoon.
Dr. Ninang.
Okay, I'm great. Yes. Actually, this is the first time we've done it in Makati Med.
All
So
right.
this is a breakthrough for not just for Makati Med, maybe even the Philippines. It's the first
Yeah.
time that LABI procedure's been done. So we don't really have data yet for the Philippines, local setting data on whether it's been done before. But as far as we know, it's the first in Makati Med. So what's
Congratulations.
special about this procedure is that it is relatively more simple than the other options that we offer our patients. We have nerve transfers where we have nerve transplants. We harvest nerves from the legs and then we transplant it to the face. We also have free flap muscle transfers, which are more complicated procedures and actually take longer
Do they,
than the labby flap. These procedures require special equipment. These procedures require special training also. Well, the labby flap also is done by a surgeon that also underwent the same training, but this is a simpler procedure in terms of the technicality
yes.
because we simply bring down the, like as mentioned by Dr. Mamur, we bring down the muscle. We borrow the action of the muscle. So instead of using this muscle to chew, we train this muscle to be used as a smiling muscle, because there are, I think, 5 mastication muscles. So it doesn't it doesn't hinder us from it doesn't affect the chewing, but we can train this muscle, the temporalis muscle, to smile. So it's a simpler procedure in the sense that it's a single setting, and we don't have to wait for anything to grow, or because for the nerve transfers, because sometimes we have to wait for like axonal growth and wait for a few months to see if the nerve is already working. So that takes a long time, and then you do another surgery. This one is single setting, one procedure. You just basically you connect the temporalis muscle to your muscle around your mouth, and it's more of a mechanical thing. So, and you train it to smile. So very, I hope.
You mentioned, yes, if it did help. I mean, you talked about other surgeries where you might harvest muscles or nerves from the legs or other parts of the body, and I mean, it might not just be one surgery. This one is simpler.
Yes.
Where it's one setting, as you said. So I'd assume it's one operation where you move the muscle from a part of the face to another face. And when you say train, okay, so you did mention there are 5 muscles to masticate. So that's for chewing. And so I guess they're attached to the jaw. I mean, or they work with the jaw, the lower or upper jaw.
Yes. It's all attached here, usually to the mandible. So it won't affect, when we do this procedure, it won't like visibly affect the chewing.
Yes.
Maybe at the start you have to get used to it. But you can, by training, we mean like there's some rehabilitation after the surgery that is also a very important, vital part of the whole process.
Yes.
So it's not just the surgery, the rehab is also very important, which sometimes we think after the surgery it's done. That's why we tell the patients, what to expect. Yeah.
Okay. Now, another question is, when you harvest the temporalis muscle, which you've already defined and explained, you in talking about exactly how it restores movement in a paralyzed area of the face, whether it's the left side, the right side, or perhaps both. How exactly, in terms of what, I guess what I'm asking is, in terms of how does it restore movement? Is this muscle very important in terms of using it? Like, what makes it so unique? Okay, so we know that one, it doesn't really affect a person's chewing much, and why is it so trainable? In other words, to Dr. Aquino, I guess, yes.
Yeah. I think it's easier to train compared to the other muscles because it's separate in a separate location. The patient can really see and feel when it's contracting, because what they have to do is to clench their teeth here, and then you touch your temple, you'll feel it moving. So it's easier for them to practice clenching that. So
Okay. Yeah, it's like when you like clench your jaw or something, you feel that muscle move, and it's kind of the Dirty Harry look, like, and you make it pulse, your cheek pulse, and then you're like, go ahead, make my day. Yeah, so you can feel it, and I guess for people, I mean, it's more intuitive when you use this muscle when you're training. Okay, so, yes, go ahead. I didn't mean to interrupt you.
yes, that's basically it.
Okay, all right. So when surgeons are like yourselves are doing this, and when you take on a case like this, whether it's alone or with others, what are the challenges that you usually face with facial reanimation surgery? Is it the patient? Is it the attitude? Is it the time? Is it the equipment? Everything. what challenges do the doctors face in terms of, and the surgeons face in terms of getting this done?
The results would be perfect. Okay. That's why it's very important that before the operation or preoperatively, it is important that we manage the patient's expectations. The goal of the surgery is to achieve what is closest to normal, but we cannot achieve 100% normal. So we can bring back the patient's smile somehow close to what he or she used to, and somehow symmetry, so that the patient's quality of life when he or she communicates to other people, he or she will be more comfortable to his current condition. He or she's not bothered about it. So that's basically the goal. So again, we have to manage the patient's expectation, because sometimes patients who have very high and unrealistic expectations, these are patients which are difficult patients. Okay, that's why it's also important for us to choose and talk to our patients.
Okay. Okay, so for any of you, and you, Dr. Mamudik, are answering this, but for any of you, in terms of managing patients' expectations, do you find that, okay, so there will be some who expect a total restoration and total reanimation, and that may not be achieved if they don't, let's say, do therapy or the training, which we're going to talk about after, like retraining that muscle, or perhaps the damage done to their nerves. Are there also, you were talking about restoring the smile as much as possible to the former smile, and also when they talk, do you find that patients also who have facial paralysis, like, have difficulty speaking, being understood, or they feel like they're mumbling? Do they not feel like themselves? And I guess it depends on the degree of injury, but can you speak to some other examples that that sort of just a couple of examples of this challenge, aside from like feeling like, oh, I don't really, I can't smile the way I used to or talk the way I used to. Does anyone have any comment about that? Like, is it more sort of like psychological, or is it also physical? And I mean, and I guess also, like, one more question is, do you find that the patients who have the most, how does it range? Like, the persons who have the least injuries are the easiest ones to, are injured less, or can more or less move, they don't have full facial paralysis, or adapt faster? Or is it the ones who have had facial paralysis for such a long time that they're just very happy to kind of somewhat get back to normal?
So I would just like to add, so for these patients, rehabilitation is also important, so that it really helps a lot to train these muscles, just like earlier what Dr. Aninang and Dr. Aquino said. But for the another question was something about it depends on the degree of the severity. That's true, because if the patient had complete transection of the nerve which innervates these muscles, so the movement of the muscles will now be completely dependent with the temporalis muscle.
Okay. Thank you, doctors. Okay.
And also earlier, we really have to manage their expectations, because we cannot, like, again, Dr. Mamurik mentioned earlier, we cannot guarantee 100%. It will all depend on the process, the surgery, and the rehabilitation. So it's something that we it's a day by day thing. So we pray for and hope for the best talaga. That's what we want. That's what we all want. But usually there's a guaranteed improvement. The results of the procedure, well, based on outside data, internationally, the results are good. there is some improvement, and they're reproducible, meaning you can do it to different patients and the results are similar. So um, it's the way the patients should be aware of this, that it's not a perfect procedure that you'll be restored fully. So that takes effort and time on our part and their part also. It's a team. It's a teamwork thing. So we'll see and hope for the best. Yeah.
Thank you, doctors. Okay, so you're talking about this managing expectations and how patients should also be aware of the work they have to put in. How soon after patients get the surgery can they start seeing any perhaps improvements in their facial movements, or how soon do they start the therapy, and like what kind of therapy does it take, how long does it usually last, that kind of that kind of thing? Just give us an idea, if you will.
Usually immediately post-operative. The post-operatively immediately. So patients have swelling. So the results are not that visible yet because it's hard for them to move because it's swollen, it's painful, there's inflammation. So it's also at this time that we ask them not to do a lot of movements. Relax, just relax muna. You don't need to do any exercises. You don't even need to chew much. It's soft diet lang sila at that time. So, but what we notice with our patient after post-op, in our experience, when the patient is at rest, you can already see immediately there's improvement in the symmetry. At this point, because immediately after, you can't really do the dynamic or you can't make the patient move much yet. So, and it's also swollen, so it won't move much either. So that's where the rehab comes in. So you wait for the swelling to go down a bit, and then you start about 15 days, 2 weeks, mga ganun, 15 days. And then from then on, there are different steps, which we will maybe discuss later, in different steps of the rehabits. And siguro, at best, siguro maybe a year is what we're looking at to see the full effect of the surgery.
Well, that's not long to wait if you have something. That's not long to wait and to work on it if you have facial paralysis, especially if it's been affecting you for so long. I would say, that's really not long to wait and working on it. And as you said, right after the surgery, if it's still swollen, you can't move it, and or maybe you can't see it. No, but there, you were saying that that you can see the symmetry has improved, or like even just at a resting point, you see it's not so defined, like that one side is completely paralyzed compared to the other. And then, I mean, maybe there are fleeting expressions that you might catch, but the person is not exactly aware of them.
Yes,
And yeah, okay. So, and maybe their loved ones will notice, or the nurses especially who attend them. Oh, okay. But of course, won't say anything yet. Just keep the expectations and the patience, of course. And you ask them not to move so much in terms of like activities, and also maybe they're try not to move their face too much. Do you also ask them? Yeah.
yes. They have a soft diet first. We ask them not to chew on hard food yet. So this will make sure that the incisions, and there will be less bleeding, and to make sure that the anastomosis, meaning what we put together, the temporalis muscle and the muscle around the mouth, the orbicularis oris, would heal first. What the muscles that we put together, so that attachment that we made.
So you'd be like, okay, don't try to talk too much. Everyone tells me that, but not in the context of not just in the context of a talk show, but not in the context of surgery. Thank God. Okay. Yeah, don't talk too much. And then sometimes like, why aren't you talking? Okay. So from that, okay. So so it's about okay, right after you can see some changes in terms of symmetry, but they have to rest, of course. And as you said, like, the things that you cut and put together, they have to repair on their own, and perhaps with some help, some medical intervention. And what kind of for Dr. Joaquin, I guess, what kind of multidisciplinary multidisciplinary approach or rehab do you require for post-surgery patients to maximize the results? Like apart from, yeah, well, I guess that's the question.
One after surgery, the most important is rehabilitation medicine, because they have to practice creating that smile. So at first, it's going to be unnatural for them. They have to clench their jaw for one side to smile. And then as the months go by, when they practice every day, maybe around 3 months, it's going to start becoming more spontaneous. Like how we smile, you don't really have to think about it, just happens. So that's the goal, to make it a spontaneous smile.
Hence, they'll be smiling like Wednesday Addams for a while, like, yeah.
They're going to be doing weird movements first.
Yeah. I do it all the time anyway. I'm like,
Yeah.
that smile out of me. Okay. But yeah, okay. So it's basically when you talk about rehab medicine, is who does it? Is it partially like, do the surgeons make the prescription? Do you use an occupational therapist? Like, what kind of therapist would be working with a patient who is practicing their smile?
More of occupational therapy is correct, and our physical therapist.
Okay. And so it would be occupational therapist, like, let's say, how many times a week? And I'm presuming they could try on their own also. Do you give them exercises to do?
Yes. There's specific instructions, and actually they're supposed to be doing the exercises several times a day so that they can get used to it. So
are there any medications that you prescribe also? I mean, apart from medicines that you would prescribe for any kind of surgery, after surgery, are they given any kind of medication to help along with this? Is there any such thing as that? I'm just really curious. Or is it just really like the physical rehab?
yes, just the physical rehab.
Okay, just the physical rehab. Okay. So, that's the occupational therapist, sometimes a physical therapist. That's good to know. And if they have any other conditions, I mean, are they prevented from doing anything that could is there something that you would tell the patient not to do that would get in the way of their rehab for to practice smile and all of?
Not maybe during the healing period, like Dr. Aninang said, just to avoid chewing during the first 15 days. But then after that, once it's healed, it's better to keep practicing it.
Okay, so let's get down to the surgery that you guys performed in December 3. Could you walk us through the highlights of the surgery or some of the things that you remember?
Yes. So for the highlights of this surgery, what's nice about the placement of the soon-to-be scars, it's hidden. That's number one. No, that's one of the highlight. One of the incisions is hidden within the scalp, and then another one here along the folds, and two more scars here above the upper lid and then the lower lid. So when scar placement, we have a very good scar placement, and then for the access, so we use the muscle, we mobilize the muscle and connected it to the muscles here along the nasolabial area. So using the, we call it a fascia here along the one which covers the muscle. So it's like we use it as a bridge to connect these two structures. And the one here in the eyelid, so the upper lid, the muscles in the upper lids, it's dynamic, okay? And the one here, meaning this is the one which actively moves. And the lower lid, it's a static. So what's nice is that the movement of all these muscles, basically the weakened muscles, depends on the movement of the voluntary movements of these normal muscles. So what's nice about this surgery is we didn't have to do complicated microvascular surgeries which needs nerve grafting or even harvesting muscles, which are so distant, such as those in the legs. So basically, it's a simple, less complicated form of surgery to address a facial paralysis compared to the other procedures, of course.
Yes. Okay, so uh, mentioning the scars, which is important to many people, there's one hidden in the hairline, essentially. Okay, and then one hidden in the folds of the eyelid. Yes, of course, which will be difficult to detect because we have folds in our eyelid, and then one in sort of the side of the okay, in the crease, yeah, beneath your nose, like going down to your upper lip, where as you know, some people are like, oh my god, I'm getting a frown line or something, and I'm like, yes, well, that happens, but you know, or you can just say I have high cheekbones. What's up with that? That's why they're there, you know. I lost some, you know, fat in my face or something. Anyway, those are where it's hidden, and yeah, there are normal creases there. And you said voluntary muscles, so as they practice, these are all voluntary movements, and somehow you connect them. You were able to connect them for a voluntary movement. How about the eyelid? It's just where the scar is hidden, but the eyelid, the movement of the eyelid doesn't count in this case because
It's part of the procedure. So the incision we use for the upper lid is actually the same incision
it's
we used to do in upper blepharoplasty. So the incision, it falls along the normal crease of the upper lid.
okay.
Then,
Thank you.
yeah.
Okay, sorry, I didn't mean to interrupt you. I was just wondering if the eyelid was involved in the motion. Like, no, Nicole, you're not understanding the doctor properly. The eyelid is not in the motion. It's just where you do the incision. So, I mean, that's wonderful to have, as you said, facial reanimation surgery that's simpler, and you don't have to like graft nerves and muscles and see if they're working, and it's all done in one sitting. Can I ask, like, aside from the highlights, like how long did the procedure take, if you're at liberty to say that, and you know, like, yeah, how long does it usually take? Because with other surgeries, it would take probably, I mean, it more often than not, probably not different, a series of surgeries. With this one, like, how long does it take? Which is also a factor that people want to consider in one sitting.
Usually it takes mga 2 to 4 hours.
Oh, okay. So that's pretty fast. That's like sitting in traffic. I mean, on a good day. Okay. All right. Okay. So, you know, when you were planning this particular surgery, what were your key considerations for this particular patient that you did the surgery on December 3?
Well, we see first if the patient is a good candidate for the procedure. So, what we determine is if the nerve that supplies the temporalis is suitable. No, if it's usually it we do this procedure for patients with flaccid paralysis, and with a good function of the nerve that supplies the temporalis, because it's a different nerve from the facial nerve. So you have to make sure that this is strong. So like Dr. Aquino mentioned earlier, we make them clench, and then if it tenses, so okay, there's muscle bulk because we need that muscle. So some patients kasi, they have the tendency, like if they're paralyzed on, for example, the left side, they stop chewing on that side because sometimes there's some food stuck there. So they tend to chew on the normal side na. They forget to use this side. So the muscle atrophies or gets smaller. It's not being used. So if that's the case, we ask the patient to do preoperative exercise if needed. So for our patient, this case, he was able to. It was still strong. No, we could feel the tensing of the muscle. So we know at that point that we could use it for the surgery.
Okay, that's a great point. Like you check it out also beforehand. I mean, yes, if the patient doesn't use that muscle or they stop because okay, when someone has facial paralysis, can it also hurt in other areas? You know, where the paralysis is not. In your experience treating patients with facial paralysis. Okay, so that part will be paralyzed, but there's another part of the face or maybe the area of the temporalis where that part can hurt. Does that ever happen? Has a patient ever complained like, well, you see, my temple hurts even though I can't move my cheek or something like that?
We have some trauma patients in my experience. They complain of pain in some areas, not necessarily on the paralyzed part. Sometimes because of the nerves, depending on the nerve damage. Sometimes it gets severed. Some of them are reconnecting, so they feel a little sensation in that area. So it's not the same for all.
Yeah, it's an individualized experience, and therefore the surgery is also individualized. And the one big consideration is that, okay, do you kind of have the muscle movement, or your muscle hasn't atrophied in that area yet, and is there a good supply to that nerve? Meaning, I guess, like, no blockages and the blood can pass through it and all that. So those were your considerations for this patient. And as you said, if there is such a case where the muscles atrophied a little bit, well, you can get the patient started on exercises pre-op, and it's so good to hear that taking everything. Sorry, go ahead.
We also assess the patient preoperatively, the symmetry, before we go into the surgery. So we check which side needs how deviated is this part, like that. So we can estimate how the repair will be after, because we have to adjust the attachment. So there, it was one of the another consideration of ours also. Yes, sorry, please.
Oh no, I mean, that's great. You're giving us all this information, so people know that the surgery can now be done in Makati Med with you three in particular. That you've done it, it's been successful, and that you take all these things into consideration, and that you do talk to the patient beforehand, even when it comes to how atrophied is their muscle. Okay, like, you need some exercises before we start this. So it's really a very complete approach. Okay, and now how about you, Dr. Joaquino, or actually all three of you? Can you share any memorable moments or insights from the operation last December 3, or this particular operation surgery that you conducted?
Well, for me, the whole thing was memorable because it's a very rare surgery for us, especially during training. So it was like we only used to see it in the books, and then we'd read and memorize how to do it. But then this was the actual thing being done. So we learned so much on the details on how to actually perform it, because it's different when you just read versus when you do it.
I suppose even if you just watch, it's
actual.
It's your actual hands. Did you use your hands and stuff?
Yeah.
I mean, like, no special equipment of that.
Yeah, we didn't need any special equipment, which is also a good thing. So it's something that we can really start doing here.
Yes.
Training.
Yes. So there was no face-off moment. I don't know if you guys watched that when you were younger. That movie. Okay, just to like go off on a tangent. Are you familiar with that movie?
It's one of my favorites before.
Really? Okay. Yeah. Whose acting did you like better, John Travolta or Nicolas Cage?
I think John Travolta.
Really? Okay. I mean, you're rooting for his character.
Yeah.
He did really well in that movie. Yeah, he did. And then, so I had to really suspend my disbelief when I watched that. And then I was like, okay, you know what? It works. I believe it. Yeah. But there were no face-off moments where you just laser the thing, then all the expressions are there. And then you're like, but their bodies look the same. But never mind. So, okay, never mind. Keep suspending your disbelief. But see, this is believable. This is real. This is not fiction. So, yeah. I wonder if that movie influenced your choice of specialty.
Maybe.
Maybe. Yeah. Okay. Yeah, for me it's okay. It was fun, but okay. So I don't know. I just thought of that. You know how it is. So they're like, okay, but we're not doing face-offs here, people. This is real stuff that these three doctors just performed. Okay, so the whole thing was memorable, and the insights that you shared were about like how different it is when you're actually doing it. And as you said, you didn't need any special equipment. You do it with your hands. So you mentioned something that really struck me. You can keep doing more of it because you don't need special equipment. And with training, I mean, you could do it on so many people who, for example, they need the surgery or they want it. And they, sometimes the equipment costs, right? When there's more equipment, sometimes it costs more if the equipment is not that, readily available everywhere. But they can, more people can basically get the surgery, and with you three guys at the helm, especially. Okay, so can you tell us about any of the most significant improvements that you have observed in the patient post surgery already at this point, Dr. 𝗵𝗹𝗁? Yes.
Yes. So one of the memorable things for us that struck us as surgeons, when we noted that, of course, we saw the patient preoperatively, the patient cannot close his eyes or cannot even smile on the affected side. But right after the surgery, even if there's swelling, but as the swelling goes day by day, and the patient is compliant with the recommended rehab exercises, we can really see the improvements that the patient can now blink his eye and already give us a complete smile, at least a symmetrical smile.
And what impact do you have? What further impact do you think it will have on the patient moving forward? I mean, it's been Dr. 𝗵𝗹𝗁 just mentioned the improvement already, like after surgery, being able to blink the eyes and smile. And what further impact do you think it'll have on the patient? Perhaps not just in terms of the facial paralysis itself, but holistically.
Life of the patient. So you provide movement to the lower part of the face, at the very least, make it more symmetrical. So not only does it have it may not be life threatening, but the social repercussions, the emotional and maybe psychological impact on the patient is a big thing. So it's important also to the patient. That's what we have to consider. What is important to the patient? And usually our patients come to us because it's hard not to be able to express yourself. If you can't even show people you're displeased or you're happy, I think that has an impact on the patient. So if you are able to restore that, just even the thought of restoring the smile, I think it's a big thing already for the patient.
I completely agree with you there from personal experience and from observing people whom I know very well, that even just being able to smile or restoring some movement in your facial expressions really makes a big difference. And it goes to how you relate to people, or maybe even how you view yourself or how other people view you, which shouldn't be really totally important in terms of how they view you. But sometimes, yeah, it does matter, because they misunderstand you. They think everything is okay with you, or why are you so grumpy? Or
you're not reacting. They see, well, there's no reaction from this person. So parang, there's no, it's nice to like, you show each other, there's an exchange. But if there's only one person doing something, di ba, parang you feel like you're lacking then. So there's, when you are able to move even just a bit, so it's a big thing for the patient already.
Yeah. I mean, you'll hear things I hear things as much simpler cases where like, oh, sige na, smile for the camera, and so I say, smile ako, wala na akong ipin or something. So even that thing alone, right? That of not having the teeth that you used to have, or not having the same look, can affect someone or your image of them. So what more if somebody has facial paralysis and now they can smile or move it or show some expression? Wow. And okay, so like, aside from the impact on the patient, what kind of how do you think this will affect any procedures or surgeries or advancements maybe in this area in particular for Makati Med in the future, like the upcoming future, like very soon and long term?
Yeah, I think this surgery is paving the way for more advancements in reconstructive surgery, and then it also allowed us to collaborate with plastic surgeons from other countries, like the doctor who joined us during that surgery. So, and also connect us with other institutions that can train us further, so we can offer it hopefully soon in Makati Med also.
So there are doctors that you worked with from other institutions, and then you can bring more of it in because you had a successful surgery and you did it already.
Yes.
Okay.
Correct.
And you can start offering it more for people who want to get this surgery. And can I ask you how common is facial paralysis in the Philippines? And how accessible are treatments like this usually to the people who have facial paralysis? How common is it, and maybe what kind of degree? Just basically an overview of how common it is and how many people suffer from it.
I also looked into the and also looked for a local data if we have any percent or number. However, they're still lacking.
Probably underreported, no?
They're underreported, but globally, it accounts for about 3%
Mm-hmm.
of the diseases of the face, which involves the facial nerve.
Mm-hmm.
And then for the how accessible is it? So as long as we make the arrangements with these patients, we can make this very accessible to these patients.
Mm-hmm. Okay. And so what can be done, and not just by, let's say, surgeons like yourself or hospitals, but perhaps by the general public or the government or any other institution or just people themselves to make facial reanimation surgery more widely available to people in the country?
Need training for the doctors. Doctors who are willing to go abroad and then bring it back in. And after that's done, we can just disseminate information, and then we can set up programs in different hospitals. And I guess if we already have a certified surgeon here in the Philippines, maybe we can put up a training program in the Philippines, so we don't have to go abroad. But yeah, this hopefully in the future we can offer this na. So we can start by training doctors and staff also. So the people who assist you will also be trained. So if surgery is faster and more efficient, and you can do more in a given period of time. So and dissemination of information is very important once we have established our programs.
I hope this particular show serves as a platform in some way, no matter how small, to get the word out there. And I'm sure going abroad is not it's something that you would like to do as a surgeon and learn and train, but it's also like, who's going to pay for it, and how widely can it really be disseminated here? So I'm glad you mentioned all those things, like if maybe people would sponsor it, and send people abroad and bring them back, or put up an institution here, as you said, and then get people here to train, and not just the surgeons or the doctors, but the people who assist in the OR, and maybe more of the occupational therapists, no? Now, how do you exercise the face and just get more information out there? So I hope that comes to fruition. Are there any plans to train in Makati Med for similar types or any other type of actually innovative surgeries, such as this one, Doctor? I think it's Dr. Joaquino. So the plans.
Well, in recent years, Makati Med, especially the surgery and plastic surgery department, they've been encouraging more specialization, because I think that's where the trend is going now. You can't just be a jack of all trades. You really have to focus on a certain specialty, because there's so many details that go into each. So, yeah, that's what Makati has been working towards, like also trying to do fat transfers and hair transplant also, aside from the facial reanimation surgery.
Do you think that, okay, because you guys know, I mean, like, how many muscles are there in the face, right? And I remember when we were younger, they were like, it only takes so many muscles to smile and more muscles to frown. And I was like, okay. So I forgot na those, facts that they would, so that you would smile more. And I was like, but shouldn't we exercise the frowning muscles as well? Okay. So, I mean, do you think, okay, you don't have to answer this if you don't want to, but do you think that really going into specialization, like for everyone, is the thing, or just like maybe sub-specialization? Because being a jack of all trades also means that you can kind of handle things. Sometimes as a patient, I find it hard to be passed off to too many people for every single thing. Although the doctors are cooperative and they deal with each other, I am dealing with so many as a patient, also the person who brings everyone to the doctor. Like, I'm dealing with so much information from others that it could be like, okay, it takes longer to come up with something. So I have to be like, God, I hope the doctors who I make kulit, please bear with me when it's for other patients. Like, I have to be texting, doing all these things, and because there's a subspecialty. But I guess for your area, you can speak to the face and plastic surgery and hair transplants and all that. Is it okay? Well, I asked the question. You don't have to answer it if you don't want to.
Yes, I think there's a point to that also, that there's so many extra steps. So that's one downside to it also, that I've noticed. There's so many doctors have to be involved just to treat a certain disease. Yeah.
I guess I as a patient and someone who brings patients, I don't mind as long as it kind of comes together quickly. But you can't also force that on so many.
True.
You're dealing with. And then sometimes as a patient, as a person who brings patients, you're like, what do I do? And then hence you become a fake doctor like me and be like, oh, I should do this. I know what the answer will be. No, I'm just kidding. I don't do that. Sometimes I do, but I know because the doctor already told me, But I guess it helps to watch shows like this and to talk to doctors like you, so that we can always sharpen our knowledge, update ourselves, update the knowledge. I mean, we always, of course, defer to the experts and the people who have actually studied and treated illnesses, but everyone has to start somewhere. And it comes with being self-aware. It kind of freaks a lot of people out. For some reason, it doesn't. I mean, it's just my role in life, and I gladly accept it. And that's why I love doing this show and talking to doctors like you and so many other doctors, because I hope it brings a little bit more into the audience's homes, into you guys' homes, and you guys' homes. Okay, it's like I'm talking to one of my clients. Hope it brings a little bit more into your homes, tsaka para mas may alam kayo, mas may confidence kayo, and you know that you can share these things. And okay, so I'll give the floor to you guys, all three of you. At one time, no, I'm just kidding. All three of you, like, is there anything you'd like to tell patients about facial reanimation surgery? For those who are considering it, are there any messages you'd like to give them, and maybe their families also, or their friends who have seen them suffer through this, or I mean, suffer through these the different conditions that that either they acquired by illness, by a virus, or by the way, has anyone ever gone to you with trigeminal neuralgia? I'm just curious. And said, like, I can't move part of my face, but it kills me with all the pain. You don't have to answer that. That was just like, shh. Are you?
I did.
Yeah.
I had it. Yeah. I was diagnosed with it. Super. Sorry, out of the.
Can I get your number? No,
But
yes. Can I get
so
your number after the show? It
But
is
it
so.
mukhang virus triggered eh.
Yeah.
E-COVID, question mark.
Yeah.
So, and it really hurt. It was the worst pain, one of the worst pains I've had in my life. So, sorry, off topic, everyone. This is not facial
Oh,
reanimation. This is me as a patient. No,
yes.
it hurt so much, and it happened in the course of like 7 days, and no one can diagnose. I thought it was a dental thing at first. So
Yes.
to the dentist. So that's like, there's nothing wrong. He took out my pasta. I was like,
Yeah.
there's nothing wrong here. I was like, oh my, what's happening? But it's good, and it happens at a certain 1 a.m. There was
Yes.
a time it happens at 1 a.m. every night. So
A
parang I'm
certain
scared na
time.
pag 12:55 na, parang, oh, I'm so scared. It's coming, it's
That is
coming.
feeling the pain. And then for some reason, it can feel also that that part of your face that hurts is paralyzed, or maybe you're not moving it, subconsciously. That's why I asked about earlier, like feeling pain in certain places, but not, but then
No,
in
no, it's
paralysis.
different.
Oh,
Yeah,
good. Then give me
check
your
your
number
mental
after the
nervous.
show.
Yeah.
Yeah.
Sorry.
Okay.
Off
Yeah.
topic, sorry.
No, I mean, that's
Doctors are patients too. Yeah.
yes, doctors are patients too. Is it true, doctors? Before you give words of hope to patients, that sometimes, in your specific cases, doctors are the most difficult patients also.
So
Yeah? Sabi ni Dr. Aquino. Mm-mm. Yeah.
you
Also,
can't dead.
mga fake doctors like me are also the most difficult. I'll bring everyone. What about you? Ay, next year na lang, ganon. Okay. So, yeah. So, I mean, any words? See, doctors are patients too, and you have all these feelings and emotions that you put into it. You put so much of yourselves into your work. So, you have any like words of wisdom or hope or anything that you'd like to tell people who are considering facial reconstruct? Ah, what is this with the reconstructive facial reanimation?
Yeah.
You know,
Yeah. Perhaps now that we are there's already public awareness and knowledge that this kind of surgery is existing. So I hope this will provide hope for
Mhm.
patients who have been struggling with facial weakness, and
Mhm.
that there is this procedure that can help them improve their quality of life.
Mhm. Thank you, Dr. Mamburik. Thank you, Dr. Aquino. Thank you, Dr. Aninang. And Dr. Aninang, when you talked about yourself as a patient, I bet doing this, I don't know, I'm betting, so I might lose the bet. And, doing this surgery and seeing someone be able to move their face, you having experienced a bout with trigeminal neuralgia was like, all right, this person has some relief. I don't know. Am I correct? Okay, so what do I win? Not I win the
All
knowledge of
patients
all
then.
patients.
All of our patients. Yes, you always want the best naman for them. Eh. You hope for all the results to be good. You make sure that all the necessary steps are done, all the right steps are done to achieve the best results for them, all of them. So that makes us all doctors happy, and we see
Mhm.
our patients, well, for in this case, literally smile. So
That's right.
yeah,
Simple smile. Um, well, I'm smiling right now, and thanks for putting that smile on my face. It's not always easy to do that on certain days, but thank you for doing that today,
you're
Doc.
welcome. Mhm.
And to the audience, thank you for tuning in. And, smile through your heart. Oh, it's not a good song. I'm just such an old soul. I come up with all these weird stuff. But I would also like to thank the people behind well, they're not people, they're canine, of canine origin. I would like to thank my four furry children for finally putting themselves in the presence of the show and apologize for their outburst earlier. They did not know that the show was already on. Usually they're very good co-producers and stuff. And they're really cute. And thank you for putting a smile on my face. That way I don't have to scold them after. We'll just be like, Okay, thanks guys. And any final words from anyone? You want to say hi to anyone? No? No highs? No hellos? No more I love yous? Language is leaving me? Ha! putting all these songs. I don't know if you get all my references because I am obviously older than you guys. Okay, well, anyway, maybe we should watch Face Off together again, Dr. Aquino, and you can point out that, see, that's impossible. No, that's impossible. And then we will completely not suspend our disbelief. But anyway, guys, this is not fiction. This is fact. This is happening now. This has happened. Facial reanimation surgery. Thank you very much for being on the program today, doctors. I look forward to meeting all of you someday in person. And if you'd like to leave your number, please do so. And I will contact you about stuff like okay. Thank you, guys. Thank you, everyone.
Thank you so much.
Thank you for being on the
Thanks for
show.
having us.
Our pleasure. Thank you.
We were able to help.
You did totally. And putting a smile on my face is going to help the people around me. Thank you. Okay. All right. So see you next week, folks, here on Healthline with Makati Med. I'm your host, Nicole Jacinto. We had 3 wonderful doctors with us today. And I'm so happy that we look like the Brady Bunch here. I love it. The more, the merrier. Thank you, guys. See you next week.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.